Anxiety-related disorders are characterized by an overactive stress response to regular daily life stresses. In essence, it is a state where the ability to tolerate stress has been drastically lowered. Our natural response to stress is designed to protect us and keep us away from serious dangers. This intolerance to stress destroys an individual's ability to lead a normal life, as they are simply unable to deal with the inevitable stresses we all face. Sufferers tend to shield themselves by cloistering themselves away in their homes. This inability to deal with stress in sufferers is not simply in their heads. This weakened state can be measured in the blood. Once these blood markers are reversed, the symptoms subside. Cells produce antioxidants which protect the cell and the body as a whole from stresses. In individuals suffering from anxiety, it has been consistently found that they have low levels of these antioxidants in their blood. This inhibited systemic cellular protection signals us to stay as far away from any stresses as possible because our body's ability to deal with them has been compromised. Conversely, once the cellular protection systems are restored to normal, our ability to face stress is restored. This mechanism has been demonstrated numerous times in animals. When animals are subjected to toxic substances that reduce cellular antioxidant levels, they develop anxiety-like behaviors. In a study conducted in Turkey on 42 individuals suffering depressive disorder, 37 suffering generalized anxiety disorder, and 38 healthy controls, it was found that vitamin E levels, which is an important systemic antioxidant, was depleted in those suffering anxiety, and markers of ongoing oxidative damage to the tissues was increased. In a study conducted in India on 21 suffering generalized anxiety disorder and 19 controls, it was found that sufferers of generalized anxiety disorder had significantly depleted levels of vitamin A, another systemic antioxidant. Treatment with the antioxidants vitamin A, C, and E were able to partially restore levels of these antioxidants and significantly reduce symptoms of anxiety. This study shows us that when the biological changes associated with anxiety are treated directly, symptoms improve and biological markers also improve. In a study conducted in India on 50 patients suffering anxiety disorder and 20 healthy controls, it was found that patients suffering anxiety had higher levels of markers of oxidative stress in the blood compared to healthy controls, and that conventional treatments lowered markers of oxidative stress. The sufferers in this group also had drastically depleted levels of cellular antioxidant producing enzymes, which inevitably result in increased susceptibility to stresses. Conventional treatment was able to partially restore the levels and function of antioxidants and oxidant neutralizing enzymes. A study from Turkey on 20 patients suffering panic disorder and 20 healthy controls found higher levels of markers of oxidative ongoing tissue damage, along with increased inducement of antioxidant neutralizing enzymes. A study conducted in Bangladesh on 50 patients suffering generalized anxiety disorder and 51 healthy controls found again significantly depleted vitamin E levels and increased markers of ongoing cellular damage. In a study on mice administered 2 chemotherapy agents known to cause oxidative stress and induce anxiety-like behaviors, NAC administration, which is a potent antioxidant, was able to prevent depletion of antioxidants and the anxiety behaviors in the mice. This shows that external toxic exposures which increase oxidative stress may trigger anxiety, and that restoration of antioxidant levels through administration of antioxidants or antioxidant boosting supplements prevents this anxiety from occurring. Panic disorder is without doubt associated with increased levels of ongoing oxidative damage in the body. Acute stress is also known to increase oxidative stress, so the sensations of panic in panic disorder may further deplete antioxidant levels. further increasing an individual's sensitivity to stress, triggering a vicious cycle. So what is the cause of the increased oxidative damage in anxiety and panic disorders? Numerous factors can increase oxidative stress in the body. Number 1, lack of sleep. Number 2, vitamin or mineral deficiencies which inhibit the functioning of cellular antioxidant enzymes. 3, smoking. 4, recreational or pharmaceutical drug usage. 5, excessive alcohol intake. 6, exposure to chronic stress. 7, lack of time for relaxation. 8, metabolic disorders. 9, low intake of antioxidants in the diet. 10, exposure to air or water pollution. 11, exposure to environmental pollutants and toxins. 12, exposure to EMF, electric smog, or radiation. Here is how you can reduce levels of oxidation associated with panic disorders and anxiety and restore antioxidant levels. Number 1, prioritize sleep. Aim for 7 to 8.5 hours per night. 2, ensure your diet contains adequate intake of all the vitamins and minerals required by the body. 3, consider taking a multivitamin, multimineral to ensure ample intake of minerals and vitamins. 4, stop smoking and consume little to no alcohol. 5, regularly exercise to strengthen the body's ability to deal with stress. 6, try to reduce any stresses in your life and learn techniques to better deal with the stress. 7, engage regularly in recreational activities which reduce your stress levels. 8, boost the quantity of antioxidants that you consume in your diet by increasing the amount of herbs, vegetables, and fruits you eat, and reduce or eliminate consumption of processed food. 9, ensure you drink filtered water. 10, if you live in a location that has air pollution, use an air purifier in your house. 11, eat organic if possible, or choose organic for products which are known to contain higher residues of pesticides or herbicides. 12, reduce your exposure to EMFs, also known as electrosmog. 13, clear your body of persistent, hard to excrete environmental pollutants. Be cautious of taking high doses of isolated antioxidants. High doses of individual antioxidants can actually increase oxidative stress. Be cautious of taking high amounts of a single antioxidant. It is generally better to aim to consume a range of food known to contain high levels of antioxidants rather than to take a supplement containing synthesized antioxidants under normal circumstances. However, in regards to treating panic disorders and anxiety with antioxidants, as these conditions are associated with increased oxidative stress and thus a high demand for antioxidants, a multiple ingredient antioxidant supplement is likely to be helpful. Conventional medications used for treating anxiety may lower oxidative stress in patients suffering panic attacks and anxiety. It is unclear the mechanism in which these medications lower oxidative stress, but they can be considered a temporary treatment if needed to function. Pharmaceutical drugs generally result in increased oxidative stress in certain areas of the body. Our environment has been polluted with highly toxic substances for centuries. These pollutants make their way into the air, water, and food we consume. While a number of these pollutants will exit the body quickly, a significant number of them will get trapped in our bodies for decades. Mercury, aluminium, cadmium, thallium, gadolinium, non-stick chemicals, dioxins, PCBs can be retained in the body for multiple years or multiple decades. These environmental pollutants inhibit cellular enzymes and functions. They also block the uptake of essential minerals. As a result, these pollutants increase cellular oxidative stress and hinder the body's ability to produce ample amounts of antioxidants. These lowered levels of antioxidants and decreased capacity of antioxidant producing enzymes in turn reduces our ability to face situations which may cause a moderate level of stress. The only way to completely rectify this situation is to rid our bodies of this toxic buildup. I started suffering from agoraphobia and panic attacks in my early 20s. I initially tried to treat these symptoms with lifestyle changes, vitamins, herbs, behavioral therapy with quite limited success. I started seeing major improvements in the symptoms after embarking on a detoxification program to rid my body of these hard to excrete environmental pollutants. Progress was slow but steady, noticing small gains every month as more of these highly toxic pollutants left my body. It was not only the anxiety that subsided, but a large number of other symptoms I was experiencing also lessened and disappeared as I progressed with the detoxification. I am now totally cured of these symptoms and have written a book about my experiences and the techniques, vitamins, minerals, and herbs that you can use to detoxify your body of its accumulated toxic burden. While our environment has been abused and polluted, substantial research has been done on the accumulation of environmental toxins in humans and animals, the effects these pollutants have, and how medications, vitamins, minerals, herbs, lifestyle can be used to facilitate the removal of these hard to excrete substances. Over 1,000 medical studies on detoxification were reviewed before formulating my book. The book contains 50 pages of references to medical studies mentioned within the book. The detoxification process must be handled carefully. The body may store some of these pollutants away in more inert places in the body, such as the bone, in order to remove these toxic substances quickly from circulation to limit the damage they cause and prevent them from spreading to vital organs. Stirring up this toxic burden can potentially drastically increase the severity of whatever symptoms you are suffering and put excessive strain on the excretory organs. By reducing your accumulated burden of persistent environmental pollutants, you will notice improved vigor, vitality, improved mood, better sleep, and possibly a large number of other benefits. Once your antioxidant defenses are no longer overburdened and are functioning at full efficiency, you will be able to face stresses inevitably encountered in life with confidence again. Click below to purchase the book and do not forget to click like on the video. Thank you.